Dear students, welcome back. In the previous session, we have discussed about one of the important visceral organ, that is stomach, and their position and its size and its external features, and under external features we have discussed about the curvatures and parts of the stomach, and relations to the stomach, blood supply, nerve supply, and lymphatic drainage of the stomach. Now in this session we are going to discuss about the interior of the stomach, how inside this stomach is present. Okay, so if you want to study, you have to open the stomach, okay, and we have to see its internal structure. Normally this interior of the stomach is divided into 4 layers. One is the mucosa, the innermost layer is the mucosa, and then the submucosal layer. After that you will find the muscular layer, and the last one is the outermost layer of the stomach is the serous coat. Okay, so now we will see each layer. So the first layer is the mucosa. So if you see, the mucosa of an empty stomach is thrown into folds. So here what are the folds you are seeing is the inside the stomach, and these are termed as gastric rugae. Okay, this rugae or longitudinal along the lesser curvature. Okay, along the lesser curvature. So this rugae or longitudinal along the lesser curvature, and these are irregular in the remaining parts of the stomach. Okay, on the mucosal surface there are numerous small depressions are present, so that can be seen with the help of a lens. Okay, so these are called as gastric pits. So through these gastric pits the gastric glands open. Okay, the part of the lumen of the stomach that lies along the lesser curvature and has a longitudinal rugae. Okay, and has a longitudinal rugae is called the gastric canal or megantrace. Okay, this canal allows the rapid passage of swallowed liquids along the lesser curvature. Okay, so this part of the lumen, which is called as gastric canal, so this allows rapid passage of liquid, so from the stomach to the next part of the canal, alimentary canal. Okay, so here the lesser curvature bears, so here the lesser curvature bears maximum reactions of the swallowed liquids. So it will not spread here the remaining part of the stomach, it will directly flows through the next part of the alimentary canal. So then what happens, so what kind of liquids you are going to swallow will have effect on this surface only. Okay, so normally which makes it vulnerable to peptic ulcers. Normally the peptic ulcers occurs at this area. So you people should be beware of your drinks. What kind of drinks you are taking, it has an effect on this lesser curvature. Okay, which leads to peptic ulcer. So this is about the mucosa. Next, coming to the submucosal layer, submucous coat. The submucous coat actually, which is made up of a connective tissue, submucous coat, which is made up of a connective tissue. That connective tissue, and also it consists of arterioles and nerve plexus. Okay, and coming to the next layer, that is muscular coat. So this muscular coat we can see in this pic very clearly. The muscular coat is arranged as the longitudinal fibers. Okay, the longitudinal fibers. So these are the outermost layer. We can see this is the longitudinal fibers. So once this superficial layer is removed, you can find the inner circular fibers encircle the body. So next layer is the circular layer. The first layer is the longitudinal layer and the second layer is the circular layer. Okay, and these are very much thickened. These circular fibers are thickened at the pylorus to form pyloric sphincter. Okay, and the deepest layer consists of oblique fibers, the next layer. So the next layer is the oblique layer. This the deepest layer, which consists of oblique fibers which loop over the cardiac notch. Here it forms a loop like structure over the cardiac notch, and some fibers spread to the fundus, okay, and rest fundus and the body of the stomach. Rest form a well developed ridge on each side of lesser curvature and greater curvature. Okay, these fibers on contraction form gastric canal. So where the gastric canal is present? By the side of the lesser curvature. Okay, this longitudinal fiber, longitudinal mucosal coat, it forms a canal like, isn't it? So how this formation of canal occurs means, here the contraction of these oblique fibers which are attached to this what you call lesser curvature and greater curvature causes the formation of gastric canal for the passage of fluid. Okay, and if you can see the outermost layer, this is the outermost layer, that is serous coat, which consists of peritoneal covering. The peritoneum is going to cover on the serous coat. Okay, so these are the features of the interior of stomach. If you see the functions of stomach, the stomach acts primarily as a reservoir of food. It also acts as a mixer of food. By its peristaltic movements, it softens and mixes the food with gastric juice. The gastric glands produce the gastric juice, which contain enzymes that play an important role in the digestion of food. The gastric glands also produce HCl, which destroys many organisms present in food and drinks. The lining of the stomach produces abundance of mucus, which protects the gastric mucosal layer against the corrosive action of the hydrochloric acid. Okay, some substances like alcohol, water, salt and few drugs are absorbed in the stomach, and the stomach also produces the intrinsic factor of Kessel, which helps in the absorption of vitamin B12. So these are all the functions of the stomach. Okay, normally if you see the clinical anatomy, gastric pain is commonly felt in the epigastrium because the stomach is supplied from segments T6 to T9 of the spinal cord. Okay, and peptic ulcers can occur in the sites of pepsin and HCl, namely the stomach first part of the duodenum, lower end of the esophagus and Meckel's diverticulum. Okay, normally it is common in blood group O. Gastric ulcer occurs typically along the lesser curvature, as I have explained earlier. Okay, why? Because means still it is having some other features, like it is homologous with the gastric trough of ruminants, that means in animals. Okay, mucosa is not freely movable over the muscular coat. Here the mucosa is not freely moved, and the epithelium is comparatively thin when compared to the other areas of the stomach, and blood supply is less abundant, and there are only fewer anastomosis at this area, and nerve supply is more abundant with large ganglia, so we can have more pain sensation regarding from this area. Okay, because of the gastric canal, it receives most of the reactions from irritating drinks. Being shorter in length, the wave of contraction stays longer at a particular point via the standing wave of incisura. We have seen here incisura. Okay, so these are all the factors. These are all the things we have seen in the clinical anatomy, and also gastric ulcers are common in people who are always in hurry, mostly worry about incidents and eat spicy curry foods. So these people will get gastric ulcers, commonly seen. Okay, gastric ulcer is notoriously resistant to healing and persists for years together, so causing great degree of morbidity. Okay, to promote healing, the irritating effect of HCl can be minimized by giving antacids, or partial gastrectomy or vagotomy can be done for the treatment for the gastric ulcers. So these are all about interior of the stomach and clinical anatomy related to the stomach. In the next session, we are going to discuss about the small intestine. Thank you.